increase in the number of COVID-19 cases in the country remains a cause for concern. The increase means more active cases require management by the health team, which means more stress on the health infrastructure and on the health team. A portion of these active cases would require monitoring in hospital, and so a rise in hospitalization of COVID-19 cases or patients is a reality, and it is adding to the burden on an already overburdened infrastructure and clinical team. In the last week, the country added some 2,818 new COVID-19 cases, and saw hospitalizations move from 245 to 270 patients positive for COVID-19. And I just pause to say here, there's a direct relationship, and this is borne out by an assessment of the data, a direct relationship between the number of cases that are reported as positive cases and the number of hospitalizations, or the increase in hospitalization. One almost naturally follows the other. The present state of hospitalization has become for us alarmingly high, and it is something we have spoken about in the past, that if we get to a stage where we become overwhelmed, and that's when we see the real consequences of the COVID pandemic. We have currently some 13 of 22 hospitals across the island at the red alert phase, which means that they have a greater than 84% occupancy level for its isolation capacity. 9 of these hospitals are at 100% or greater capacity. The current hospital census shows that Cornwall Regional Hospital, Falmouth Hospital, Annotto Bay, Port Maria, Mandeville Regional, Maypen, Kingston Public, Princess Margaret, and Spanish Town hospitals all exceed their capacity to house patients who require isolated care. And this, of course, has to be worrying, not just for public health, but for the entire country. All 4 regional health authorities have 2 or more hospitals in the red alert zone. The Western Regional Health Authority has 3 or 4 hospitals in the red zone and 1 in the amber zone. NERA has 3 or 4 hospitals in the red zone. SERA, or Southern Health Regional Authority, has 2 or 5 hospitals in the red zone, and the Southeast Regional Health Authority has 5 of 9 hospitals in the red zone. So the conclusion, therefore, is that the country is facing a serious challenge as it relates to availability of hospital space due to the increase in cases. We know that the clinically ill, on average, spends some 14 days in hospital. So we've looked at the numbers, approximately 14 days. Those who unfortunately pass are usually hospitalized for between 5 and 7 days. So we're designing solutions bearing the statistics in mind to try to respond to the factors that we currently face as public health and as a country. So here are some of the policy responses. While we continue to encourage observance of the protocols to prevent as the most significant line of defense, we clearly have to respond to the high demand or increasing demand for hospital space. So as a ministry, we have consulted with our team on the ground and have put the following plans in place to address the increased hospitalization and the demand for general care at the public health system. First is to look at how we can increase the bed count. So in addition to the field hospital spaces, which are yet to be deployed, but very close to being deployed, and I visited the two last week, Falmouth and St. Joseph's Hospital sites, and they are pretty much complete and are now being prepared in terms of the internal infrastructure and staffing. In addition to those, totaling some 72 beds, we're adding an additional 20 beds at the National Chest Hospital, and I visited the National Chest Hospital yesterday. Their COVID ward was 100% taken up, 36 beds. They are now adding additional 20 beds, and we're providing for them some additional infrastructure to support that. As well as at the University Hospital of the West Indies, where I again visited yesterday, they are converting an existing ward for general usage, which contains some 25 beds, to being an additional COVID ward. So UWI, which was again at capacity with 41 beds, are adding an additional 25 beds in order to accommodate the increases in the numbers, or the expected increases in numbers. In terms of the 4 field hospitals, that's another important response to the challenge. To further increase our capacity, field hospitals are being built. As I said earlier, we visited Falmouth General Hospital in Trelawney, St. Joseph's Hospital and Medical Center in Kingston, and the Mandeville Regional Hospital in Manchester. The 40-bed field hospital that was originally sited at the National Chest Hospital is being moved to Spanish Town, and I believe we had made that public earlier, so that again will add some additional capacity. The Ministry of Health and Wellness had initiated an arrangement with the Andrews Memorial Hospital. This is an additional possibility that will come on stream for the accommodation of overflow of non-COVID patients. So it's not a COVID hospital. It will take some of the non-COVID patients out of the public health system, and so create space for patients who require COVID care in the public health system. So that's an agreement, a public-private arrangements between ourselves and the Andrews Memorial Hospital. And this arrangement will now come into effect, and fine-tuning of the transfer protocols are being made. And so this will happen in short order. So in effect, we're adding a fair bit or significant number of additional beds to support the overflow that is now taking place based on the some 360 or just under 370 COVID beds that we had in the system. And that for us is an important response, because one of the things that we have to avoid would be for persons needing hospital care not to be able to get hospital care. The other challenge, however, having put in place the beds or the infrastructure, is the staffing. And there are challenges there too, but nevertheless, we are working to expand our staffing capacity. The expansion of staff will be done over time, but we have asked for that to begin immediately. It has started. We will then make further assessment, taking into consideration any changes in hospitalizations and capacity. What we have said, and I've met with the Regional Health Authority up to a short while ago, which is why I was a bit late for this meeting, each Regional Health Authority has been instructed to hire additional staff based on their needs assessment. The hiring of additional staff for us is extremely important and comes against a background of shortages, not just because of expanded usage of our staff based on the new numbers of COVID, but also because the mass recruitment of public health practitioners, and in particular our nurses, by neighbors, neighboring countries, has been increasing. And I'll give you one example to support my claim. Yesterday at the University Hospital of the West Indies, I inquired about the nursing shortage that they have, which they were explaining to me. And one of the reasons given for the shortage was that between January of this year to date, in February, less than 2 months, that institution has lost some 42 public nurses working there who have migrated to other jurisdictions based on more attractive offers that have been given. We don't have a policy to restrict. Labor is free to move, but you can imagine that it has placed significant additional strain on the University Hospital of the West Indies and across the board, generally speaking. So I want to encourage at this time, given the challenges that we face, persons who qualify as nurses, specialist nurses, and others who would like to join the public health team, even on a temporary basis, to contact the regional authority or your parish office, because we have instructed the regions and by extension parishes and institutions to assess their need and to bring additional capacity on as needed as part of dealing with the expanded capacity of infrastructure to deal with this challenge. And that includes persons who may have retired, who still have the energy and the interest. We'd like to bring them back on board, at least for a period of time, to deal with the challenges that we face. I want to just quickly also speak to the policy position of the government as it relates to the overcrowding. And I say overcrowding because it is the situation that we face now is being amplified by the fact that we are seeing a general uptick in hospitalization across the board, even for non-COVID patients. And so in the general wards, you're seeing more persons suffering from various respiratory ailments. And this again is adding to the stresses in the system. The very firm policy of the government, which should be instituted at all levels of the public health system, is that no one should be turned away based on overcrowding, based on a lack of beds. Everyone turning up at a public health institution, and a hospital in this case, should at least be triaged. In other words, an assessment should be done to determine the state of that individual. And every region, and by extension hospital, has been asked to put in place temporary provisions, whether it is tents and chairs, to ensure that all are triaged, are assessed, and that the normal protocols around the possibility of transfers to other institutions are followed, or any other recommendation that clinically fits the profile of that particular individual's issue. But no one should be just turned away carte blanche on the basis that we have no bed to house that person, or we are short in terms of doctors. At the same time, I want to say that our doctors and our nurses, our institutions of public health, are under severe stress. And I cannot overemphasize that. And what that stress means is that our personnel are carrying more than their normal share of the responsibilities of care, to offer care, to provide care. They are competent, they are qualified, but they are fatigued and they are tired for the most part, because they're doing many more hours than the normal number of hours of a working day. And it is therefore important for us to make the next announcement or next call, which is, if you don't need to go to a hospital, please do not. At this point in time, unless you think it is absolutely necessary, visit maybe your health center, make a call to your doctor. Don't go, because what you'd be doing, unless you think you absolutely need to, is further clogging the system and pulling attention of the practitioners, the public health practitioners, away from the cases that are more severe and that are required for that attention. So it's very important that while we will not turn anyone away, in a sense, you would be depriving someone who really needs the help if you go and it's not absolutely necessary to be there. The other important point I want to raise is that the reality of the situation now dictates that those who go to our public health institutions at this particular point in time are likely to experience wait, and longer than usual wait. So patience is going to be very important, and I understand the stress and the emotions attached with sickness, but the truth is, with the limited capacity that we have of personnel and sometimes infrastructure, expect to wait beyond the normal wait times at this point in time. It's not deliberate. It is because of what we have found ourselves in terms of the particular situation. So we're not turning away anyone. For non-emergency cases, we would wish to advise members of the public to use the health care systems, the health centers, sorry, and we ask you to expect waits. Finally, from a policy perspective, we have had to, in a number of institutions, postpone, delay, if you will, the elective procedures that would normally take place, so elective surgeries, because that capacity is required to deal with the emergency cases around COVID as well as other emergency cases. So you may have a particular procedure to do which is not life-threatening, and it will require that any date that you have, it may require that that date has to be pushed back until we can normalize the situation. And this is regrettable, but nevertheless, it is necessary because of the practical challenges that we face. I want to just quickly speak to an issue that has been in the media.